at the Ernest N. Morial Convention Center in the jazzy city of New Orleans. And this is the premier anesthesiology educational event in the world. Anesthesiology 2014 brings us an education-filled week. Coming up on ASA TV, learn whether you are the physician anesthesiologist of the future and how to set up a perioperative surgical home. We kicked off day one at the opening session with President-elect Dr. Abenstein speaking on the future of the ASA.
You will hear much more about the progress we have made as a society in championing this new model of care from speakers later this morning.
Then, President of the ASA, Dr. Fitch, presented on some of the society goals met during the last year, such as NACOR's designation as a QCDR. We continued the program with the topic of the day, disruptive innovation. Dr. Wong spoke about the disruption in technology going digital and how this disruptor has helped improve efficiency in technology. He compared that to the modular and integrative approaches in anesthesiology, stating that in order for us to become the anesthesiologist of the future, we need to embrace the wave of change and integrate innovations such as the new perioperative surgical home model of care. Session speakers, Drs. Warner and Kane, continued the session with the idea that the evolution of the specialty requires change in order to reduce catastrophic outcomes.
So totally inspired by the presentation, and I absolutely know this is where we need to go with our practice.
I am very, very much behind what he had to say. I think that we can play a very important role in expanding what physician anesthesiologists can do in regards to PSH, and I think that it's very important to continue to expand that throughout the rest of the country and get all of healthcare behind this, and I think we can have a very important impact on the future of healthcare.
I thought the presentation was outstanding. It really challenged us to think about how we're going to approach the future and whether or not things that we have been ignoring in the past really are the key to the future and how we're going to change our practices and improve care.
Next on the schedule was the international perspective of the specialty, challenges in anesthesiology from a European perspective. While patient care and quality delivery are a common theme around the world, this session, developed in collaboration with the European Society of Anesthesiology, or ESA, took a different look at the challenges in the growing field of evidence-based perioperative surgery.
I think it's important because we have the same goal as anesthesiologists, even in Europe or in the United States. We want the best outcome for our patients we are caring of. So we are in a period of big changes in our profession, a lot of challenges. It's a challenging one, and we have to improve this. And we want to make this process of the perioperative caring of the patient a continuous one.
We are here in the exciting Anesthesiology 2014 home base, the Connection Center, where physician assistants can go to get information and resources about ASA, as well as learn about the latest technologies in the industry. The Connection Center is your one-stop shop for specialty innovations. Take the time to get to know what products and services are available to you and your practice. See new devices that streamline your efforts and learn about new technological programs that can lead your team to provide better care for your patients. Learn more about the benefits of being an ASA member at the Resource Center.
Well, first off, it's the best anesthesiology show on the planet. We already know that. Okay? Second, for the type of people that will use our product, it's going to change how they do business, make it easier to do, faster, and more cost-effective, not only for them but for the patient. It's the perfect place to be.
We continue with groundbreaking panels and discussions, and be sure to check out the Pocket Guide, which details over 500 sessions. Diving further into those sessions, whose guidelines and practice parameters apply to anesthesiologists raised numerous questions. Among them, there is who writes them, and are they composed using a rigorous methodology? The session emphasized that the goal of optimizing patient care is largely determined by recommendations based on strong evidence. The perioperative surgical home is being featured all week here at Anesthesiology 2014. Today's panel on this important new ASA initiative, led by Dr. Zeev Kane, looked at ways to set up a PSH, improve the coordination of perioperative care, and develop practice models to study the scope and operational elements of a PSH model. The panel of experts answered questions on the setup and gave insight on the most important facets of the model.
So there are two things. There is coordination of care from the minute the patient meets the surgeon until 30 days after discharge, and reduce variability that is related to the system itself, not related to the patient condition. So more standardization, less variability, because variability leads to increased costs and errors.
It said a picture is worth 1,000 words, and in the emergency room, a picture might save a life. It was a packed house for the Ellison Pierce Patient Safety Lecture. Competence and teamwork are not enough. Cognitive aids have been around for years, and attendees say the aids can be valuable, but see challenges in using them.
I really like the way David went through some of the positives and negatives of the cognitive aids, so you can actually make a rational judgment and know where the pitfalls are, so you don't fall into a blinders on approach, and you can actually break out when you need to.
I am already using some of these aids, and I find them very helpful and useful. So it's nice to hear what the pitfalls are, for instance, and how to kind of circumvent those. So overall, really great lecture.
No, I think it was brilliant. I think this is something that I think we all need to do. One of the things that we like to highlight, we like our residents to have the electronic ability to get information, so to have some kind of checklist or cognitive aids is very useful. So I thought it was a great session.
Make sure to check back tomorrow for highlights from the Connection Center and 2 sessions focused on pain. The strain of pain lies mainly in the brain, and neuropathic pain, from mechanism to outcomes. Also, listen in on the riveting Rovenstein lecture, Healthcare at the Crossroads, the imperative for change. It's been an exciting day of education, innovation, and connecting. We're at the 2014 ASA annual meeting, and it's now time to meet old friends and make some new ones. We leave you now with some of the sights and sounds from the welcoming reception. This is ASA TV, and I'm joined once again by Dr. Richard Dutton, who is the Chief Quality Officer for ASA, and we wanted to get into this new Qualified Clinical Data Registry. Very important, but give us some ideas of how important it is and what you hope to accomplish with it.
Well, I think it's going to be an essential activity for every physician going forward, so it's more alphabet soup right now, but it's something we're all going to have to figure out. Briefly, where we left off with the last conversation, the federal government has a big interest in promoting quality in healthcare. Their most current mechanism for doing that is this QCDR, Qualified Clinical Data Registry. The whole idea of pay for performance, and this is broadly in the pay for performance system, is that instead of simply getting paid for doing something, volume, every time I anesthetize somebody, I get paid, we will get paid for our outcomes. So achieving good health, taking good care of patients. And the in-between layer is a bunch of measures. So we will measure physicians, show how well they are meeting standards of good care, show that their outcomes are good, and then put some of their pay at risk for that. That's the snowball rolling down the big federal hill. So this hits anesthesia. We need to be prepared to do this for our members. We need to be prepared to facilitate their quality management efforts, their measurement and reporting efforts. So what the QCDR is, it's a registry, and in fact it's the registry we already have. that physicians contribute to. They tell us about the operations they do, the care that they do, and their outcomes. And we turn around and package that information for them and give it to the Centers for Medicare and Medicaid Services, CMS, and that's who runs this program, thereby qualifying our members for incentive payments and helping them avoid penalties if they don't do it.
Is this going to make the process simpler?
In the long run, yes. In the short run, it's a lot of alphabet soup. I mean, it is a complicated process. Unfortunately, every anesthesia practice is going to have to figure this out because the amount of money at risk is going to increase steadily. Right now, for an average anesthesia practice, it's 2 to 3% of what they get paid by the government is at risk. But in 5 years, it'll be 10%. And in 10 years, it might be 20%. And in the long run, our entire pay may be based on these performance measures. So,
You've probably hit the #1 challenge, but are there other challenges as well as?
Well, the QCDR is a challenging program. As I say, you have to understand why you need to do it, first of all. Then the AQI, ASA are here to help people do that. You have to eventually figure out what you're going to measure in your practice with your patients, what data you're going to put on the table to do this. And that comes from a wide palette of available measures now, so that each individual anesthesia practice can pick the right ones for them.
But are you comfortable with the learning process, learning curve, as it were, eventually being a benefit and a cost savings, perhaps?
Well, yeah, the quality efforts are clearly working. We have good data in our registry that our clinical outcomes have improved just over the 4 years we've been in business. We can see that practices that measure their results, that report that information to their physicians, they get better.
That sums it up. And Dr. Richard Dutton, thank you so much for joining us.
Thanks.
And this is ASA TV.